We have a quorum. Madam Clerk, please call the roll.
Senator Hornback. Senator Southworth. Senator Yates. Representative Bowling.
Here.
Representative Hart.
Here.
Representative Minter.
Here.
Senator Meredith. Chairman Cook.
Here. First item on the agenda is consideration of the minutes of the January 12th, 2021 meeting of the Government Contract Review Committee.
Second.
Motion is second. Clerk, please call the roll.
Senator Hornback. Senator Southworth. Senator Yates. Representative Bowling. Representative Hart.
Yes.
Representative Minter. Senator Meredith. Chairman Cook.
Yes. Motion carries. All vendors are registered with the Secretary of State's office. The next item on the agenda is from our deferred list. That's item number 34 from the January routine personal service contract list. I believe we have Mr. Mark Carter with us virtually. Sir, if you could please identify yourself for the record.
Mark Carter.
KCTCS would be the deferred list.
Oh,
So the individuals from KCTCS.
okay. Mr. Carter, do you have any other individuals with you from KCTCS?
I do not. Astrid Masterson is with me from procurement.
Mr. Chairman, Mark Carter is with Cabinet for Health and Family Services.
Yeah, that's not.
Oh, I'm sorry. I'm on the.
That's okay.
I'm on the wrong list. We're going with the. We need representatives from the KCTCS. And they are here in person, so welcome. Mr. Carter, we'll be back to you. Sorry. Okay, I believe Senator Southworth had some questions. You guys want to, if you ladies want to introduce yourself, and then we'll get. Welcome very much. And Senator Southworth, I believe you have some questions for them.
Yeah, I just wanted to get a little bit of a handle on the outfit that we have selected being out of state and kind of what the scope of the project is and who consultants in Kentucky aren't able to provide those services.
Ma'am, can you check to see if your microphone's on, please? Maybe you have to pull it up.
Sorry.
Much better.
We were looking for a digital agency that specializes in what we call enrollment marketing, which is basically putting butts in seats, right? And who specializes in higher ed, particularly community colleges. And this has kind of been a new phenomenon as digital advertising has grown over the past really 10 years, that people have become very specialized in specific fields. And there are no agencies in the state of Kentucky that have this specialization. In fact, there are very few in the country. So the agency that we picked, this is what they do. They only work with community colleges. They only work on increasing enrollment. So this is why we went with this kind of firm.
Thank you.
If I may just briefly follow up, are you guys familiar with El Toro?
Mm-hmm.
And so El Toro's, my former legislative assistant has been there from the beginning. I do know they target and work closely with a lot of colleges as far as trying to reach youth and parents by digital marketing, and they've been a lot of rewards really from like all throughout North America really for what they've done. Something we're proud of here in Kentucky, starting here and be able to keep one here. Would that be a contract they would have been able to bid on?
They could have, but they did not.
So that was placed out to bid for them?
It was.
And they chose not to. Thank you.
Okay, any further questions? Do we have a motion to consider the contract reviewed without objection?
Motion. Second.
Motion and a second. All those in favor, vote aye. Clerk, please call the roll.
Senator Hornback, Senator Southworth, Senator Yates, Representative Bowling, Representative Hart,
Yes.
Representative Mentor, Senator Meredith, Chairman Cook.
Yes. Okay. Motion carries.
Thank you.
Thank you, ladies, for being here.
Now we're going out of order to let Nate do all this.
Okay. Total number of items on the agenda today, 206 in the amount of $62,967,000, $188.35. It's a large sum of money. The next order of business is consideration of the agenda, including the deferred list, personal service contract list, the PSC amendment list, memoranda of agreement list, memoranda of agreement amendment list, and the corrections list, except for those items selected for further review. Do we have a motion to consider the contracts reviewed without objection? Motion made by Meredith, Senator Meredith, sorry, and sorry, I did not mean to promote you there, Senator.
Emphasize the word promote.
Second by Representative Hart. All those in favor vote aye. Oh, sorry. Clerk, please call the roll.
Senator Hornback,
Get a roll call.
Senator Southworth, Senator Yates, Representative Bowling, Representative Hart,
Yes.
Representative Mentor, Senator Meredith,
Aye.
Chairman Cook.
Motion carries. Okay, in order to accommodate a request, we're going to go slightly out of order today. The first item we will discuss on the polled list is with the Attorney General. This is number 1 on the routine MOA, the pink list. So if Attorney General, if representatives, you guys could come forward, identify yourself for the record, and we will get started.
Sorry. Stacy Woodrum, Executive Director of the Office of Administrative Services.
I'm Chris Lewis. I'm the Executive Director of the Office of Consumer Protection.
Thank you all for being with us here this evening. I believe Senator Southworth will lead us with the question.
Thank you, Mr. Chairman. So I would like to hear a little bit more details about the settlement and obviously how that money flows. I think we've heard about it, but need to see a little bit more in-depth detail here.
So this particular settlement that this deals with is the Purdue Pharma settlement that was reached with the Commonwealth, I believe, back in 2015, and I believe finally signed into effect in 2016. Payments over that were spread out over an amount of time. The amounts that this MOA deals with are some of those legacy payments that go forward from year over year that the legislature has appropriated to be sent from the Attorney General's office to the Justice Cabinet for further conveyance to Operation Unite.
Mr. Chairman, could I ask a follow-up? So is this an annual payment, or you said legacy payments over time? So
This is an annual payment over time. The way that settlement was structured, there was a lump sum payment up front and then certain numbers of payments to be made afterwards annually. They usually arrive in about January of every year. And I believe you'll forgive me if I don't have that in front of me, I believe there are 2-3 years worth of payments left.
Yes. And this is per House Bill 352 of the 20 session. For that language is included in the contract, that it flows from the Office of the Attorney General to Justice Administration Cabinet per that House bill.
Okay, thank you.
Are there any further questions? Senator Meredith.
Appreciate y'all being here this evening. Can you give me a little background, thumbnail summary of what Operation Unite program is, what it does?
of course, our cabinet or our agency isn't directly involved with that. My understanding of Operation Unite is that it is a drug prevention and recovery program. I believe it was started by Congressman Hal Rogers sometime maybe around 2003, I think is what I have in the back of my head. But I'm not intimately familiar with the program other than that it is a drug prevention and recovery program that the legislature has, chosen to send this money to for a number of years now.
Well,
Yes, sir.
this may not be a fair question for you because it's more of an operational type issue. It may be more appropriate for the finance cabinet, but settlements of this nature, are they routinely determined by each respective cabinet as how those funds are going to be used? I guess more specifically, I'm just curious why this particular settlement, the funds didn't go to the general fund for the General Assembly to determine how they should be used.
I would have to look back at the underlying settlement on this one. I'm not since this was settled long before we came into office over the AG's office. I've not looked at the specifics of that settlement agreement. I do know in current opioid litigation, one of the things that many of the opioid defendants are concerned with is that large portions, if not all, of the money in the settlement be earmarked for abatement. That may have been the case here, and that may be why those funds are being directed by the legislature to Operation Unite. That would be my guess, but without fully reviewing that prior settlement agreement, I don't
I appreciate these aren't
today.
fair questions for you because I'm just concerned and I guess interested in knowing the efficacy of such programs. If we're doing it, are we getting results? And obviously that's not within the course of this contract. You can ask it, but Mr. Chair, that's a concern I have is we're approving this, but we don't know if it's effective. I guess that's the issue.
I would say in prior years, my understanding is the Justice Cabinet was much more closely working with Operation Unite and the way the MOAs were done. I mean, again, we're kind of a conduit for the money. It was an Attorney General settlement, so the settlement check comes into our office, and our office just effectuates that transfer to the Justice Cabinet. And I believe the Justice Cabinet is probably, because of the prevention elements of Operation Unite, probably somewhat more familiar with the actual implementation and everything that goes on with that.
I'm sure they are. It just concerns me that, within Chapter 45A, each respective cabinet has settlement authority when we bring litigation against somebody, and which means this kind of precedent that even if they have settlement authority, there's no guarantee that those funds will come back to the General Assembly for earmarking for whatever purpose. So, again, that's a discussion for another day, but that's a concern I have, Mr. Chair, that we don't have control over those funds.
That's a very valid point, Senator Meredith.
And my understanding, and we'll be happy to look at this and get back to you, Senator, if you'd like. We can pull that settlement and look at it. I don't know if the settlement agreement itself directed funds to Operation Unite. My impression was that was actually a legislative decision, and that legislative decision has gone forward over time.
I'd appreciate if you would double check that for me. I don't
Certainly.
think it has any difference in terms of approving this contract this evening, but I would like additional information on that and be able to track the authorization for that and how it's been dispersed over the years. So I'd appreciate that.
Certainly.
Thank you, Mr. Chair.
Any other questions or comments? Senator Southworth.
Just to clarify, I'm looking at House Bill 352 from 2020. It's the executive branch budget, so I suggest maybe we check on the budget and see if we didn't put a line item in there. Obviously, it's a little much to do on a phone with 2%, but that's where we could look first. As to the efficacy of the Unite program, I've heard mixed reviews, which is one of the reasons why I flagged this to kind of check into what's exactly going on. Thank you.
Questions or comments? We have a motion by Representative Hart. Is there a second? Second by Representative Mentor. Madam Clerk, please call the roll.
Senator Hornback, Senator Southworth, Senator Yates, Representative Bowling, Representative Hart,
Yes.
Representative Mentor, Senator Meredith, Chairman Cook.
Okay, next item on the pulled list is with the Department for Public Health and is number 3 on the routine, the PSC, that is the green list. And if the representative is here, please come forward, identify yourself for the record. I believe you're with us virtually.
That's correct. It's Mark Carter. I'm an executive advisor with the Cabinet for Health and Family Services.
Okay, Senator Meredith, I believe you have questions on this.
Yes, Mr. Chair, I do. And Mr. Carter, appreciate you joining us this evening. A little bit bewildered by this one. I wish you'd give me a little bit more background. I hope you can appreciate we just get kind of capsule summaries as to what these contracts are going for. But this deals with the obviously the mass vaccination of the citizens of our Commonwealth. But part of my confusion is if it's coming through the Department of Public Health, isn't that task, hasn't that been handed off to the Transportation Cabinet?
Well, Senator Meredith, just to give you a little background on it, as you know, the primary issue here is trying to do the best job we can to get as many citizens of the Commonwealth vaccinated as quickly as possible. To that end, Governor Beshear asked Secretary Gray of the Transportation Cabinet to assist with the whole distribution process, and that I think was primarily done because of Secretary Gray's background with large-scale project management and logistics, in terms of both his business background and the job that he is doing in the Transportation Cabinet. But the actual vaccination effort wasn't transferred to Transportation. It was more of Secretary Gray and some of his staff has been loaned to the Department of Public Health to help organize and move the vaccination effort forward. So that's the background in terms of how we're, I guess, the organizational approach to it, if that's helpful.
Well, partly, but I guess I have to tell you, I have a real aversion to emergency purchase requests and retroactive approval of requests because I think it's fraught with potential mismanagement. And again, we've been almost a year into this process, and I'm just a little bit disappointed that this wasn't anticipated and that we didn't do an RFP on this. Take a little bit further. The company that you awarded, the contract's going to be awarded to, was the same consulting firm that we did a no-bid contract on for the contact tracing. So there's just, to me, a very disturbing pattern here that we're awarding contracts where we're not submitting RFPs, and it just looks a little bit suspicious to me that the firm that was awarded was the same one that got the previous contract that was no bid, and they were not the low bid. And, one of the justifications for that was something about their communication tools were more adequate. And can you give a little bit more clarification as to why this was awarded to this particular firm when it was not the low bid?
Are you speaking to the contact tracing?
No, to this particular contract.
Well, in this particular contract, what it entails, Senator Meredith, is the contractor is assisting the department with the overall project management of the vaccination effort. So this goes to, the timeliness, accountability, who's doing what, when it's due, how are we allocating vaccines across the Commonwealth, and that sort of thing. It was a situation, or the reason for no bid was that it was a situation where I think we all felt a great deal of pressure to get vaccine out across the Commonwealth as quickly as we could and into the arms of our citizens. And so we didn't really have, at least from my perspective, we didn't have time to go through a full procurement process. But what we did is that we did invite other bidders We did review the responses that we got from the other bidders. It wasn't inside of a normal RFP process, granted that, but we did get comparable bids. Deloitte was not the low bid, but they were not appreciably higher than anybody else either. And they met the requirements that we had for the qualifications, and they were already here. And we could start virtually as soon as we could get a contract signed, and we could move forward with the vaccination effort. So that was the rationale behind it. They have about 10 people involved. They give us access to public health experts within their firm, as well as people that are on the ground helping us manage the vaccination effort.
Mr. Chair, if I could.
Yes, sir.
I appreciate what you're saying, but don't these other firms that you received informal quotes from, don't they have those same capabilities? You make specific mention that Deloitte was the only vendor to propose using a proven communication strategic tool. What is that tool?
Well, that was one component of the response. It's essentially has two broad components. One is a project management, what we call a project management office. And there are a number of tools and techniques they have there, as well as human resources that they brought to bear. And then the other aspect of it is there is a significant communications effort that goes along with it. So outreach to communities, like just last week, I did a session with about 100 people in the Murray-Callaway County area to explain to them what we're doing with vaccines, get them ready for to be a vaccine site, and so on. And part of the scope of what Deloitte's doing is they're helping us prepare for those meetings. They help set them up. They prepare the materials that we use. They track a lot of the follow-up after the meeting, and that's a component of the communications part of the contract.
Well, I appreciate that, but that doesn't look like it's a skill that's really unique to any consulting firm. It's just basic communication skills. But again, one of my concerns is that we've been in this for almost a year. We knew this day was coming. Why we didn't anticipate it and do an RFP for this particular contract? And again, it bothers me that the same firm that got a significant consulting agreement with no RFP back in earlier in the year gets this contract as well. And the fact that your people have familiarity with these people should not be a consideration, I don't think, in awarding these contracts. So this is just a little bit too loose for me, Mr. Chairman, to be comfortable with it. We're charged with the responsibility of making sure that every dollar spent as wisely and efficiently as possible. And from the information that I have before me today, I can't attest to that. And I think that puts us in a very uncomfortable position. That's why we have RFPs, and I don't really think this should qualify as an emergency purchase request, but it is what it is. But I just don't think it's appropriate.
Senator Meredith, if I could comment, one thing that I did leave out is that we want to bid things when we can. The issue here wasn't familiarity with Deloitte so much as a speed to stand up the office and to accelerate the vaccine effort. What we did do, though, is we said that we're only going to run this through June 30th, and that we will conduct a full RFP process for the July 1 and beyond, should we need to continue these services beyond June 30. So just, I don't want you to think we're cavalier with this. We're trying to do the best job we can to accelerate the vaccination effort, and we felt like that was a reasonable action to take to be able to do that.
Well, I appreciate everybody's working very hard on this effort to try to get it resolved, but I think you have been cavalier with it, and it just disappoints me. So, Mr. Chair, that's all I have.
Yes, sir. Mr. Carter, follow up. I don't understand why we would turn to a private consultant to advise on how to effectuate a mass vaccination program. This is a once in 100-year situation. Seems logical to me that no one firm would have the expertise on what this rollout should look like and how it's going to happen. Or And I just want to make the important point, and I guess ask the question, was it ever considered to use the National Guard? The military has the greatest experience in mass mobilization, logistics, vaccination, more than any other firm who would possibly bid this. And just wonder if you have any comments on that, sir.
I don't know the answer to that. I can only answer that I didn't consider the National Guard. It was a specialized service. I actually have a background in that industry. And, you know, the typical contractors that you would look to for something like this would be firms like Deloitte, Ernst & Young, Accenture, firms of that nature. I think the National Guard has been involved in the COVID response, but I can't really comment to what extent or what, you know, someone else may have considered with respect to the National Guard.
Senator Southworth.
Yeah, I have a question, Mr. Chairman. HLN Consulting, $151,000. And that is so far away from some of these others. In fact, then you got this other one here that's half the price of the Deloitte one. Can you describe, were these partial contracts, or are we having bells and whistles, or what's the big difference there between the choices?
I don't have those in front of me, but at the time when we reviewed the contracts, it was pretty clear that those contractors didn't understand the scope of what we were looking for. We had, as I recall, we had 5 responses, I believe. Astrid Masterson's on, and she can verify that. 3 were pretty comparable in terms of scope and price, and 2 were outliers that were significantly lower. And when you read the responses, it was clear that they were not qualified to do the work.
Follow up, Mr. Chairman. One last question on this. So the list of 7 vendors that got the initial email, is that a list that you typically use for all types of contracts that you need emergency, quick, here's a list in our back pocket of the 7 people we know? Or is this kind of depending on the type of projects? Like how does that list of 7, where is it stored and what all do we use it for?
So I'm Astrid Masterson with the Cabinet for Health and Family Services. The list is where we pulled on 7. It was vendors that we had done work with previously in the consulting field and that we knew of immediately to be able to contact outright.
Okay, thank you.
Do we have a motion to consider the contract reviewed?
So moved.
We have a motion by Representative Minter. Is there a second? Second by Representative Hart. Madam Clerk, please call the roll.
Senator Hornback. Senator Southworth. Senator Yates.
Aye.
Representative Bowling.
Yes.
Representative Hart.
Yes.
Representative Minter. Yes. Senator Meredith.
I'd like to explain my vote, Mr. Chair.
Yes, sir.
I'm voting aye on this contract now because I want to, because I don't want to be accused of slowing down the COVID relief effort. But I can tell you, I don't like this contract. I don't like the process. I think it should have been anticipated. I appreciate that Mr. Carter hasn't had a lot of experience in this committee, but please note that I don't like retroactive approval of contracts. I don't like emergencies unless they're truly emergency. I don't think it fits this classification. This, I think, is disrespectful of this committee and the legislature because it doesn't allow us to do the job that we're been assigned the responsibility to do. So I'm just very disappointed that we're having to deal with this, particularly when this should have been anticipated months ago. But I vote aye, Mr. Chair.
Chairman Cook.
Yes. Motion carries. Thank you all for being with us today. The next item on the pulled list is with Eastern Kentucky University. They are numbers 13 and 14 on the routine PSC green list. If the representatives are here, and I believe they are, please come forward, identify yourself for the record.
Thank you, Mr. Chairman. Ethan Witt, Assistant Vice President for Government Relations at EKU.
Hi, I'm Mark Howard, a Senior Associate Athletic Director at EKU.
And I'll point out for this first item that has been pulled, those folks are joining us virtually from the Kentucky Center for School Safety.
Okay, if they could go ahead and identify themselves for the record as well.
Good evening. This is John Akers. I'm the Executive Director of the Kentucky Center for School Safety.
Okay. Senator Southworth, I believe you have questions on these.
Thank you, Mr. Chairman. Are we doing 13 separately from 14 or rolling together here? 13 first? Okay. I'm on 13 then. I just wanted to get a little bit of background on this training, the national speakers and supplies. Trying to get, I think I have an idea of what we're doing here, but what exactly are we training on and what kind of national speakers are we talking about?
Okay, let me kick the ball off on this one real quick. The Kentucky Center for School Safety has co-sponsored the Kentucky Council for Children with Behavioral Disabilities for about the last 18 years. They have a conference every 2 years in our state. And of course, school safety plays a big part of this behavioral disability issues as well. But with us, we have the president of the group, Tracy Francis, who is prepared to answer your questions on that. Tracy, would you please answer her questions?
Yes, I will answer. So the cost of the conference, actually, we are using the funds to pay for presenters only. We, the KYC CPG group, we have paid for the cost of the presentation as far as the Zoom platform that we are using out of our organization. The speakers, the national speakers, they are, all the speakers are vetted speakers that we have worked directly with the co-ops within the educational regions in Kentucky. And we have worked with the Office of Behavioral Health. And we also work directly with some people from KDE to identify those needs within our districts and within our state. And then presenters that have presented nationally that have actually been gone to and someone has attended the presentation or vetted it through other means such as media. And we pull them in based on the vetting process. So the national speakers that we are bringing in, there's Amy Conningham. Actually, the Virtual Behavior Institute is kicking off in 30 minutes, and she is the first presenter on there. So she is there. We have so far we have 10 confirmed speakers, and the cost of some of these speakers were covered with other partnerships that we have in the state of Kentucky.
No further questions on number 13, Mr. Chairman.
If you have questions on 14, you may go ahead and.
Okay. Well, I just wanted to get just an overview since they were here on the 14.
Okay.
Sure. Testing, it says general 100%. I don't remember. There was one of these that we got mixed up that was actually federal funds. I don't know if this is that one or not. I might be mixed up. But
sure, let's get an explanation.
I think we have a lot of CARES money out there. I'm just trying to figure out how this came out of the general fund.
Absolutely.
Sure. This is specific to student athletes, and Mr. Howard can speak to that. This vendor had been working with the university, providing student athlete testing at no cost to the university. There was a period of time after the first of the year where we thought costs could be incurred, and that's why this contract was issued with a retroactive start date, should that have happened. I'm pleased to report that during that time, no costs have been incurred on this contract. And in fact, yesterday we had a conversation with the vendor that we do not anticipate any costs to the university in the foreseeable future.
Great, thank you. Any further comments or questions on 13 and 14 for EKU? We have a motion by Senator Meredith. We have a second by Representative Hart. Madam Clerk, please call the roll.
Senator Hornback, Senator Southworth, Senator Southworth,
We're voting.
yes. Senator Yates, Representative Bowling,
Yes.
Representative Hart,
Yes.
Representative Mentor, Senator Meredith, Chairman Cook.
Aye. Motion carries.
Thank you, Mr.
Thank you
Chair.
very much for being with us today.
Thank you.
Okay, moving forward. Next item on the pulled list are with Health and Family Services. It's item number 17 on the routine PSC green list, and items 45 through 67 on the PSC amendment ivory list. We're going to go ahead. We want to talk about these as a group. We're not going to talk about these individually unless a member needs to do that. But if they could identify themselves for the record, please. I believe you're virtually.
Hi, I'm Lisa Lee. I'm the Commissioner for the Department for Medicaid Services.
Hi, I'm Jason Joseph, Pharmacy Director.
Okay. Welcome. Thank you for being here. Chairman Meredith, you want to start us off with the questions?
Most certainly, and thank you, Commissioner Lee, for joining us this evening. Obviously, what caught my attention first is under the contract amount, it says 0. I wish we could have more contracts like this, but can you explain to me what the payment mechanism is? Obviously, they aren't doing this for free.
Yes, Senator Meredith, the bidder proposed a per member per month fee for each pharmacy transaction, and the MCOs will be responsible for paying the single pharmacy benefit manager that we have obtained through this procurement process.
How many firms responded to your RFP for this service?
I would have to double check, but I think about 5 or 6. I can't remember exactly how many responses we had, and I'm not sure if Ms. Masterson is still on the meeting invite, and if she can respond to that.
Do you know why?
I am.
Sorry.
Oh, sorry, Senator Meredith. I'm on. I believe that there was 7. Sorry, I'm getting some feedback. Finance Cabinet did run the procurement, but I believe there was 7 responses, if memory is correct.
Can you give me some insight as to why this particular firm was chosen?
This was based on the procurement process and laws. We followed those, of course, to a T on this one. We did have 2. We had 2 protests, but they were subsequently dropped. But this provider, this contractor was chosen because they scored higher on the overall contract, even in the orals presentation, because we did do orals with the top 3. Just to make sure that we covered all bases and that the individuals coming into this were very aware of the importance of this project, considering that it is stemmed from Senate Bill 50. And this is the very first of its kind in the nation in a Medicaid program. We're the first to mandate that the MCOs use a single PBM in which we administer the contract. We set the rates, and they have to follow the rules that we outline in the contract.
Which, from previous committee testimonies that you and I both had participated in, very excited about this development. I guess the last question I have for you is: I thought that the full component of Senate Bill 50 would not be implemented until July 1st. So, why is this a January to December contract?
I'd have to look at the day. Is it January 1st, 2021? Because we've started the process right now. We have brought them on board. Now, while they are on board, they are not processing claims. So the actual payments for this contract will begin when they start processing claims for the MCOs.
So it's just building the system at the present time. Is that what you're saying?
Yes, and we're also pulling in the managed care organizations for to make sure that all these systems are aligned properly. Again, we know how important this is. We know that all eyes are on us, and we want to do this correctly. If you remember, in January, we did move to the single preferred drug list, and we had a few hiccups in that. Got those straightened out, I believe, pretty quickly, and we want this to go off if we can without any hiccups whatsoever. So we are definitely looking at every aspect. We're going to be doing some testing, making sure that when we start with we don't want anyone to lose a medication or a delay in their medication once we implement this process.
Well, I certainly appreciate your commitment to that. Last question I have for you is, how many other states is this company doing this service for?
I'd have to go look back and look at their responses, because there was a requirement that the vendor that we select would have to have a business and doing Medicaid business, PBM in other states or with other like agencies. In this company, I believe, was doing business in several other states, but I can get that specific information for you and send it back to you, Senator Meredith, if you'd like me to tell you that.
Yes, ma'am, I would, and certainly that information is not going to impact the decision on this contract, but I would like to know. Thank you, Mr. Chair.
Okay, to keep things clear here and separate, we're going to have to do separate motions. So this is just for simply, before we move on to 45 to 52 and 53 to 67, is there a motion to approve item 17 on the routine green list? Motion by Representative Bowling. Is there a second? Second by Representative Mentor. Madam Clerk, please call the roll.
Senator Hornback, Senator Southworth, Senator Yates, Representative Bowling,
Yes.
Representative Hart,
Yes.
Representative Mentor, Senator Meredith,
Aye.
Chairman Cook.
Yes. Motion carries. Okay, now we're going to move on to this is going to be 45 through 67. We're going to talk about those as one group, and I've got two probably very obvious questions here, but I want to ask to start this off. Why was it inadvertently not filed? And the follow-up on that is, this goes back to July 1 of 2018, when COVID really only was back to March of 2019. If I could just get some clarification on that, please.
This is Brian Thomas, Finance and Administration Cabinet. I believe I can address that question. These contracts were let initially in 2018. They are agreements that multiple state agencies can utilize, and so finance let these particular contracts. At the time, they were not filed, but since that time, as our letter explains, OPS has developed a process where they are filing these particular agreements with the Government Contract Review Committee, and in fact are moving to a system where they will automatically be filed by the EMAR system.
Any further comments or questions?
Mr. Chair, I'd like a clarification on that. I still don't understand why they weren't filed.
Senator Meredith, obviously that was done prior to this administration, and so unfortunately I can't give you too many details on that, but when OPS looked into it, we did realize that they were not filed and have moved to correct that since that point.
This may sound like a rhetorical question, but what's a master agreement? How do you define what gets purchased under a master agreement and what doesn't?
So the term master agreement is just a term that is utilized in the EMAR system. Ultimately, it is a contract that can be utilized by multiple agencies in the Commonwealth.
What's the criteria for determining whether something's going to be purchased under a master agreement versus RFP and whatever other processes we have there?
Well, it's generally a request by the agency if they want or if it's a contract that makes sense to be utilized by multiple agencies, finance will let those contracts as master agreements.
And if you're under a master agreement, are you still subject to the same RFP processes that all other contracts are subject to?
Yes, the 45A contracting process is the same.
Do you know, is it defined anywhere in statute what a master agreement is?
Senator Meredith, it is not. Again, that term just arose out of the EMAR system. It's just a term in that system. This, for instance, these contracts here are just contracts for professional services.
Well, I appreciate that, but we've approved other professional services, and again, that's what our PSC list is for. And I'm just a little bit confused as to why we choose one time for something to be a master agreement, the next time it's a public service contract. There's no particular criteria for that, other than each respective cabinet decides it's going to be a master agreement.
Again, master agreements and contracts that can be utilized by multiple agencies are let by finance, where individual agency personal service contracts are let by the individual agency. Cannot be utilized by other agencies.
But there's nothing in statute that really defines that or dictates that should be handled that way.
So 45A provides that the finance cabinet shall be shall run procurement for the entire Commonwealth. And so I think that gives rise to the ability to let contracts for multiple agencies.
Well, I appreciate that, but you're saying technically everything could be a master agreement if finance decided it is going to be a master agreement, in theory.
So I'm not sure about that. Honestly, I haven't thought much about that, but finance is the agency that procures services and goods for the entire Commonwealth.
Then what's our role in this process?
Senator, your role is set forth by 45A. I think it's 795.
Yeah, I'm full aware of that, but again, we're supposed to check as to whether these purchases, to abbreviate this discussion, are valid or not. If they're under master agreement, then it looks like we're precluded from even discussing that because it's already done.
Senator, it's my understanding that these master agreements or multiple agency contracts were filed before the committee because they represent services that are under the jurisdiction of the committee.
Representative Hart.
I just have I just know, items 53 through 67, it's all dealing with contract tracing. And we discussed this at our June 9th meeting, and I would just, can you give me some further information? How, with the contract tracing, how's it going? I mean, the fact that, are we using these funds? Are these funds being used to do contract tracing because you're asking for an extension, or are they just sitting somewhere right now?
Well, this is Mark Carter. I'll try to answer that.
Okay,
the funds are being used for contact tracing, and the background on this one is that these were contracts that were let back in the May timeframe that ran through December 31st. Using CARES Act funding, and these are the contracts that were used to add disease investigators and contact tracers across the Commonwealth. That program continues into this year, and these are just extensions of those previous contracts. So yeah, but the contact tracing effort and the disease investigation component of it are ongoing.
And they're all federal funds, correct?
Yes.
All right. Thank you.
Senator Southworth.
Thank you. I wanted to go back to the contact tracing question. it seems to me months ago we heard reports, and I think Jefferson County maybe felt like they were getting somewhere with their contact tracing, but most other public health departments, at least in the news, had pretty much put their hands in the air and said, we have no clue how this thing's moving around. And I mean, I'm not sure anybody does. And they said they kind of gave up on contact tracing. I mean, this is going back several months ago, so I'm wondering what exactly are we doing now, since everybody's had COVID and nobody knows who's been around who.
Well, we are. I'll start with where we are, and I'll back up. I mean, we are doing contact tracing currently. It's one of the components of the public health response that includes social distancing, masking, and now vaccination. But it is true that the contact tracing component of the program was put under extreme stress with the spike in the spread of the disease in November, December timeframe. And what we had to do is we had to make some decisions around how we would prioritize those folks that we actually had a contact tracer call and talk to. So the adjustment that we made there was to anyone that tested positive for COVID would get a call from an RN typically that does what's called a disease investigation. That has to happen with every positive test. So you have to complete that portion of the contact tracing program. In a perfect world, then, what part of that process would be to gather the list of contacts from that person that tested positive, and then a contact tracer, another staff member, would call each of those individuals. And, if they were subject to an exposure that would require them to have to quarantine, then that person would talk to them about the requirements for quarantining and talk to them about any personal needs they might have during that time period. What happened with the surge in the disease is that we had to say that, we would only try to contact the contacts that were at the highest risk of exposure. So if, maybe they had other health issues, they were elderly, those kinds of things where we would actually make an actual contact with them. For everyone else, what we did is we developed some one-page guidelines that we gave the person that was infected, and we asked that person to help us by letting their friends and contacts know that they had come into contact with, that they'd been exposed to COVID, so that those people could take the appropriate action to protect themselves and their family and neighbors and so on. So, if you heard reports that people didn't get called by the health department, or reports from the health department that they were having trouble keeping up with the contact tracing, that's why that was happening.
Representative Bowling.
Thank you, Mr. Chairman. To follow up on some of the contract tracing, I'm new to this committee, was not here back during June, so I'd say some of these are questions you answered then, but questions nonetheless I would like to know the answers to. But a total of 15 firms were awarded contracts, and it's a little bit under $106 million total. Why did you decide to go with 15? What went behind the decision making on that?
Well, I have not been in front of this committee before on this topic. These contracts were actually led before I came on board. Astrid Masterson is on with me, but I will give you my understanding, and she can fill in the blanks. But essentially, the contracts, again, this was at the start of the pandemic when there was, as you well recall, I'm sure, quite a bit of concern about the disease and how fast it was propagating. And so, in order to stand up the contact tracing program that was recommended by the CDC and the White House Coronavirus Task Force, we felt we needed staff. And the best way to do that was to utilize staffing agencies because these people would be deployed across the Commonwealth. They weren't going to be in a call center in Frankfurt. They were going to be deployed in virtually every county in the Commonwealth, and different staffing agencies are stronger in different areas of the Commonwealth. So the contract was let in such a way that if an agency could meet the criteria that were established by the cabinet and the finance and administration cabinet, then they would be eligible to have a contract. And I think at the time, something like 22 agencies met that criteria. I think we probably ended up primarily dealing with, predominantly with probably about a half a dozen, but there may have been 15 that actually, employed staff and had an arrangement with the cabinet. But hopefully that's explanatory.
Okay, just a quick follow-up, if I may. Of those 15 contracts, 13 of them were between $7,036,000 and $7,151,000. There were 2 contracts that fell outside those ranges. One was for $5,218,000, another for $8,505,000. They're for the same time periods, and I just wondered, when you see 13 that are all right there, it's very, very similar, and then you see 2 that are higher or lower, just wondering the differences there. And the line item number 60, that's the one that was $8,505,000, Atrium Staffing LLC, and then item number 65, NTT Data Inc., that was $5,218,000. So that's my question.
Sure. This is Astrid, and I might be able to answer it, but I'm going to tag in Tom Stratton's on here as well. When we set up these contracts for administrative wise, we did just a flat amount to each of the vendors so we could administratively get people hired very quickly and get them out into the field. In regards to the difference on it, Tom, can you speak to that?
Yes, I can. This is Tom Stratton. I'm also with CHFS. So the difference on the 2, the first one being $8.5 million, I think. I had it here in front of me. What happened, that was a vendor that's been used quite a bit. The services, there you go, Atrium. They just happened to place a lot of people, probably in a lot of different areas of the state. And as they got towards the end of the calendar year, they were running short on the contract amount. So we had to add some funds there to make sure that we could pay the bills when they came in at the end of the year. So that's the reason for that one. On the other hand, before we get to NTT, a lot of these that are on here for the blanket amounts of $7 million, a lot of these are approaching nowhere near that. Okay. Half or less in some cases. The one for 5 point something for NTT. So that one was when we renewed these to go through the end of June, that was the last vendor. NTT is a large company, and I guess, through whatever processes they have, that was the last vendor who signed. And forecasting ahead by their usage, there was no need to make that one $7 million. That's the only reason is we didn't predict that we're going to need to use that much money. So that's the only reason that one's lower, because they came in probably 2 to 3 weeks on the signature as the rest of the vendors. So that's the only reason that one's lower.
Okay, thank you.
Any further questions or comments on 45 through 67? Is there a motion to consider these contracts? Motion by Representative Minner. Is there a second? Second by Senator Yates. Madam Clerk, please call the roll.
Senator Hornback, Senator Southworth, Senator Yates, Representative Bowling,
Yes.
Representative Hart,
Yes.
Representative Mentor, Senator Meredith,
No.
Chairman Cook.
I'm going to vote yes on this, but I'm going to need an education on master agreements. Look like a convenient way to bypass our committee here, and it's something that I really want to look for and get an education on, but I'm going to record a yes vote on this today. Motion carries. Thank you all for being with us today.
Thank you.
Okay. Let's see. We're here, aren't we? Next, number 20. Next item on the pulled list is with the Kentucky Public Service Commission, number 26 on the routine PSC green list. So the representatives are with us here today. I believe they're virtually. Please identify yourself for the record.
Yes, my name is Linda Bridwell, and I'm the Executive Director of the Kentucky Public Service Commission. And with me is Karen Wilson. Karen, are you on?
I'm on. Hi, Karen Wilson. I'm the Legislative Affairs Director for the Public Service Commission.
Welcome to Government Contract Review.
Thank you.
Senator Meredith, I believe you have some questions for me.
Yes, sir. I do, and I appreciate our friends testifying this morning. Just a second, I need to find my note here. I'm assuming this is a result of the legislation I think we passed last session dealing with net metering. Is that correct?
Yes, sir. It is.
And we're trying to set up a system to implement that. Is that a fair assessment of this?
Yes. We were looking for a consultant to not only assist in our staff in reviewing any applications for net metering, but also to make sure that we are looking at the best practices across the country.
Well, to that end, why this particular firm?
Well, it's obviously a very unique skill set. We put an RFP out according to the procurement code. We ended up getting 2 responses back. This one was the response that was going to not only be able to help us analyze, but also train our staff on how to evaluate the upcoming net metering options and put the methods in place. So that was why we selected this as part of our selection process.
If you would tell me again, how many proposals were received?
I believe we only received 2 proposals.
And where was the other proposal from?
Karen, I don't know that one off the top of my head. Neither one of them were from the state of Kentucky.
I think I'm going to provide clarification. We did a first RFP and then we did a second. In the second round, we received, I think, 6.
Oh, I apologize.
6 proposals. Yes. That was predated your coming to the PSC.
I apologize for that.
No one from within this region of the country
we had we may have had one that was more within the state of Kentucky. Most were more national. But I can double check on how many were actually from Kentucky.
I appreciate knowing that, and I'll just share with you, Mr. Chair, this is just one of those things that, much like retroactive approvals, no bid contracts. So I've got a problem with contracts with companies from California, because you may recall a couple of 3 years ago, the Attorney General of California prohibited any state employee to come to Kentucky. And I just don't know from a philosophical standpoint why we want to build up the economy of California when they don't cooperate with Commonwealth of Kentucky. So,
good point, Senator Meredith. Any other comments or questions on this? All right. Do we have a motion to consider the contract reviewed without objection?
Make a motion.
Motion by Representative Bowling. Is there a second? Second by Representative Mentor. Madam Clerk, please call the roll.
Senator Hornback, Senator Southworth, Senator Yates, Representative Bowling, Representative Hart.
No. Can I explain my?
Yes, sir.
I'm voting no on this contract, and I'm going to echo Senator Meredith's concerns. The state of California made it pretty clear to the state of Kentucky several years ago that they would not do business with us, and so I don't think we should do business with them. So I vote no.
Representative Mentor, Senator Meredith.
Explain my vote, Mr. Chair.
Yes, sir.
I'm a no vote for the reasons that Representative Hart noted. And thank you, sir.
Chairman Cook.
Yes. Motion carries. Thank you for being with us here today.
Thank you. Thank you all.
Okay, moving to the next item on the pulled list. It's with the Legislative Research Commission. Their number's 27 on the routine PSC green list and number 4 on the 10,000 and under goldenrod list. Welcome. Sir, please identify yourself for the record.
My name is Jay Hartz, and I am the director of the Legislative Research Commission.
Thank you for sticking with us tonight.
Well, you pay me to be here all day, so here I am.
Okay. Senator Southworth, you want to start on number 27?
Yes. I want to find out, and I understand the retroactive. I've been in this situation before myself as that staff person trying to make this decision. I understand the hourly rate issue, same explanation. I also understand the idea of sole source, but my real question is, how did this one particular firm, do we have a list of people we kind of go to, or how do we just pull them out of a hat, or how do we decide that? Because this is obviously a big and important issue, and how you pick one person out of a whole state is my question.
So, I am not on the impeachment committee. It would be inappropriate for me to attend, participate, or listen in on their executive sessions. But my understanding of the state of affairs is that the rules that the impeachment committee adopted to govern its operations provided them the ability to retain outside counsel. And this individual, this lawyer from this law firm, was the individual that committee determined had the length and breadth of knowledge necessary to provide them guidance as they consider facts, options, and courses of action as they move forward. Occasionally, I do what you tell me to do, just so I keep you guessing about what I'm actually up to. And my general counsel and I, Greg Woosley, who's in attendance with us here, received a directive from Representative Nemes, chairman of the impeachment committee, that this was the individual that the committee had identified to be their counsel. Mr. Woosley spoke to that person, confirmed some details that had been represented to him by that lawyer, just to make sure that they tracked with Representative Nemes' understanding of the situation, and we executed the contract you see in front of you.
Okay, thank you.
Thank you, Senator.
Okay, since they're on two different sheets, are there any other questions or comments on number 27? Yes, sir, Senator Meredith.
Jay, I just want some points because I didn't pull this contract. So
I'm just happy to see some new faces up there, Senator.
I'm sure you meant no disrespect for the previous committee members. So.
Absolutely. I always enjoyed Representative Lee's perspective.
Yes. And I appreciate that you're still relatively new to your position, but just as a way to make your job easier in the future, and there's nothing in the statute that requires this. There's no administrative reg, but what I've encouraged people to do, when you know you're going to have a retroactive approval, is let us know at the time that occurs rather than, sometimes it's 2 or 3 months after the fact. It just gives us a heads up and I think heads off the possibility of the contract even being pulled. But my aversion to retroactive approvals is it looks like somebody's trying to pull something over on us. And sorry, I'm just suspicious of nature, so not criticizing it, just suggesting that in the future, if you have a retroactive approval, you know it's going to happen, communicate that to us as soon as possible so that we're aware of it. And that allows us to do our job and allows us to move forward.
Fair enough, Senator.
Thank you, sir. Appreciate it.
Any further questions on number 27? Need a motion. Motion by Senator Meredith, second by Representative Mentor. Madam Clerk, please call the roll.
Senator Hornback, Senator Southworth, Senator Yates, Representative Bowling, Representative Hart,
Yes.
Representative Mentor, Senator Meredith, Chairman Cook.
Yes. Motion carries. You're not off the hook yet. We're going to move on to number 4 on the goldenrod list. Let's see, who had the question on the golden? Do you know number 4? Who had the question? I've sought clarification on this, and I understand this was for the House protocol under COVID. Is that correct on the number 4 there?
It is. My understanding of the state of the affairs is that Speaker Osborne determined that he would like someone with appropriate credentials to examine COVID-related protocols that the LRC had adopted agency-wide, but also, in particular, modifications he was considering or had implemented related to House operations. And he identified Dr. McKinney with the University of Louisville as someone with a unique ability to look at what we were considering, what we were up to, and to be able to provide him some context and an overview of how that fit into best practices that he was aware of other institutions that similar to us that would be having folks coming in and out of business, in and out of their business, or in and out of their place of work. So. Dr. McKinney performed that for the speaker, and as I understand, that was a key component in his considerations as they developed the thought process of how we were going to try to do this in a safe sort of way.
Very good. Any other questions or comments on number 4?
Motion.
Motion by Senator Meredith, second by Representative Bowling. Madam Clerk, please call the roll.
Senator Hornback, Senator Southworth, Senator Yates, Representative Bowling, Representative Hart,
Yes.
Representative Mentor, Senator Meredith, Chairman Cook.
Aye. Motion carries. Thank you very much, sir.
Mr. Chair, before Mr. Hartz leaves the table, just want to commend you on the job you've done, Jay. I know this hasn't been easy putting all this together and trying to make it as safe environment for us as possible. So I appreciate the efforts you all put into this. I'm sure it's been a monumental task for you.
I appreciate that. I am blessed with many smart, dedicated people, and we are all committed to being here so that you all can do what you need to do to represent your constituents, advocate for bills or policy positions that you want. So I will say thank you, not on my behalf, but all the people who every day come in here and take this seriously and do the sorts of things that they need to do to be here to serve you.
Well, obviously, a lot of planning went into this, Jay. It's obvious, and to be prepared for us when we come into session the way you have been, I appreciate the effort. So please extend my appreciation to you, to your people as well.
Well, I'm also pleased that we don't have to look at the one one screen that worked in here a couple of times over the summer. So I once again I will say thank you, but not on my behalf, but on everyone else's behalf.
Thank you to all the LRC that worked on that. Okay, next items on the pulled list are with the Department for Public Health, numbers 37, 38, and 39. This is on the routine MOA pink list. They with us here virtually, I believe, so please identify yourself for the record. Anybody with the Department for Public Health?
This is Astrid Masterson. I believe Jan and Ellen are on from Public Health as it relates to this specific contract.
Yes.
There we go. They are. Okay.
Okay, welcome. Please identify yourself for the record.
Hi, Ellen Bernard. I am the Program Director for the Kentucky Women's Cancer Screening Program in the Department of Public Health.
And I'm Jan Chamness, and I'm the Division Director for Women's Health, also in the Department for Public Health.
Very good. Welcome to Government Contract Review. Senator Southworth, you want to start us off?
Thank you, Mr. Chairman. I'm looking at number 37 here, and it says that we're providing funds for women's health services, one of which is family planning, and I'd like to get a little more detail on what all services you all provide.
The services that are provided under the Family Planning Program are clinic services, counseling to women, primarily uninsured women, and provision of the approved methods of birth control.
Follow up, Mr. Chairman?
Yes, ma'am.
Does this counseling include anything regarding abortion?
No, ma'am.
Thank you.
Representative Bowling.
Thank you. I had some questions on item 38 and 39. When you're talking about, I think it has to do with COVID testing. I think it's the temperature check stations. And how much are we paying folks an hour on that? You know, do we have an average kind of figure? You know, the people that are sitting there doing that work.
This is Mike Tuggle with the Department of Public Health Administrative Services Division. That contract was I think it's a fixed amount up to $90,000 for, I think it was temporary personnel that would be hired to support that service. So as of right now, we've not paid anything, but the contract was written with those terms up to, I think, $90,000 per month, 6 months at $540,000.
Okay, and do you know where that sits right now currently?
As far as the service?
Yeah, as far as the amount spent, the service, we think it's still worth it.
Yeah, well, again, we've not seen an invoice from Finance Cabinet yet for those services, but I believe, knowing the fact that they're manning all state buildings, plus I think we've got a location at the L&N building in Louisville, and then also at the Capitol. I think that's a placeholder to hopefully ensure that the staff that may be hired to do this temporary service, that would cover that cost.
Okay. Is there any way we could get more information on the number of people that are actually there doing this work, the temperature check work, number of locations, and then maybe total number of people doing it?
Yeah, and
this is Astrid Masterson. We do have Commissioner Sam Ruth on and Troy Robinson from Finance Cabinet on, and they're overseeing the program. They might be able to provide those specific numbers for you.
Astrid, this is Troy, Finance Administration Cabinet. So we have a total of 18 employees performing those functions right now.
Okay, thank you.
Mm-hmm.
Okay, any other questions on 37, 38, or 39? Senator Southworth.
Thank you, Mr. Chairman. And welcome, Troy. Good to see you again. I have a question about the temperature checks. The information that they collect, is that monitored or recorded as far as like, okay, we checked 103 people and their temperatures were above or below whatever we're looking for? Is that information that we're collecting?
No, it is not. In certain instances, there were numbers of temperature checks that were taken, but not the actual temperatures that were taken. So I don't know if that answers your question or not, but that's how we had to look at this.
Okay, I guess my question was mainly toward, do we know, are there a certain number of people that were turning away because of a certain higher temperature, if we have a log of that or not?
We do not have a log of that, and there have been a very small number of people that have had a high temperature, and I don't have that number at the moment.
Follow up, Mr. Chairman?
Yes, ma'am.
Can we get that number?
I'm not sure if we ever recorded that, but I'll look to see.
Okay.
I'll do that.
Thank you.
You're welcome.
Further comments or questions on 37, 38, or 39? If not, I'd entertain a motion. Motion by Senator Meredith, second by Senator Yates. Madam Clerk, please call the roll.
Senator Hornback, Senator Southworth.
Explain my vote, Mr. Chairman.
Yes, ma'am.
I'm going to vote pass because I'm sitting here with 3 different ones and I've got different feelings about all of it. And the temperature checks, this isn't even about this committee per se, but I just think I just have a real problem as I walk in the door. I think it's unconstitutional. They're stopping legislators on their way to session, take temperatures. I understand that's not the entirety of this, but I'm just going to vote pass right now.
Senator Yates. Aye. Representative Bowling.
Aye.
Representative Hart.
Yes.
Representative Mentor. Yes. Senator Meredith.
Aye.
Chairman Cook.
Yes. Motion carries. Thank you all for being here. Department of Agriculture, welcome. Are you with us today? Next items on the polled list with Department of Ag, numbers 41 and 42. This is on the routine MOA, the pink list. If they could please identify themselves for the record.
Hi, good evening, Chairman. I'm Melanie McPartland. I'm the Executive Director of the Office of Marketing for the Department of Agriculture. And I believe we still have Chad Smith on as well. I'll let him introduce himself.
Yes, and I'm Chad Smith, Division Director for Promotion and Development in the Office of Agricultural Marketing.
Okay, welcome. Senator Southworth, I believe you have questions on these.
Yes, it says multi as far as who we're actually having this MOA with. So I'm wondering if we could get a little more details on what that means.
Yes, Senator. We have 2 different programs that are on these contracts. The first one is called our Point of Purchase program. It's a marketing program, so the vendors for that program would be farm families. They have to demonstrate that they have farm impact, and we cost share 50% of their marketing efforts, provided that they use the Kentucky Proud logo. So for that one, it would be farm families in Kentucky, and they are required to be part of the Kentucky Proud program. For the second piece, that's the Buy Local program. The vendors on that would be restaurants that have demonstrated their commitment to buying from our farmers in Kentucky. And so they submit reimbursement off of those purchases. There are, in both programs, there are yearly and lifetime limits. But with the Buy Local program, it's an incentive program to hopefully foster relationships between our farmers and encourage them to overcome any cost prohibition. If local food is more expensive, get to know them, start buying their food, and then incorporate that into their menus long term.
Fantastic. Thank you.
Senator Hornback, Senator Southworth, Senator Yates, Representative Bowling, Representative Hart,
Yes.
Representative Mentor, Senator Meredith, Chairman Cook.
Mary Carpenter, are you with us?
I am.
Okay, there you are. Welcome.
Hello.
Sorry, we don't know what the delay is, but welcome to Government Contract Review. So I have a question for you about if you could just start maybe with a brief explanation about this. I kind of confused where all this was going and then the money coming out of the general funds with it.
Sure. So just a little bit of history with this contract. So you can see from the description that it sort of discusses the citizens review panel, and I don't know if you as far as the modification, and it's a little bit this contract used to flow through the Eastern Kentucky University, and so prior to that, there was a contract with the University of Kentucky for this, just what you're seeing here with the Citizens Review Panel description. And so this past year, we broke out a lot of the work that the University of Kentucky was doing from the EKU contract, which was being subcontracted with them to save on some of the administrative costs that we were funneling through EKU. And so we did modify, we broke that out and pulled that out of that contract and contracted directly with UK. And so they have a training resource center themselves that we're doing a lot of work through. So what you're seeing for the Spanish translation program and the Kinship Navigator is some of that work that we're contracting with them. Now they've been already doing the Kinship Navigator program for a couple of years now. So that's a federal grant that we received. So that's actually 100% federal funded because of the Consolidated Appropriation Act that just passed. And then the Spanish translation program is really a result of wanting to translate our foster parent curriculum into Spanish, which we have never done historically.
Okay. Any other questions or comments on number 12? Motion by Senator Meredith. Is there a second? Second by Senator Yates. Madam Clerk, please call the roll.
Senator Hornback, Senator Southworth, Senator Yates, Representative Bowling,
Yes.
Representative Hart,
Yes.
Representative Mentor, Senator Meredith,
Aye.
Chairman Cook.
Aye. Motion carries. Okay, next item on the pulled list is with the Department of Public Health. It's number 17 on the MOA, the amendment, the TAN list. The representatives are here. Please identify yourself for the record.
Mike Tuggle, Department of Public Health, Division of Administration and Financial Management.
Welcome. We've got almost $15 million here, and I wanted to talk about, it says provide funds to reimburse University of Kentucky for community-based COVID-19 tests on non-insured, non-Medicaid eligible citizens of the Commonwealth. And if we could just get an explanation on that.
Yeah, so that language was it's in there incorrectly. It's really for anybody wanting a test. They can schedule and receive a test. So it really, that was language I think was put in the first round of the contract that later got taken out because of its inappropriateness. So again, it's for any population that's being served through UK, which is not just the Lexington folks. It may be the surrounding counties of, Jessamine and Scott and so on, but it's any population, go online, schedule, and be tested.
15. Senator Southworth.
I just wanted to get a clarification where it says federal and general funds. Back to my question, like I asked earlier, is the CARES funding that's all federal not providing everything, and what's the general part of this?
So so this contract started back in September, and it was funded with CARES, exclusively with CARES coronavirus relief funds. So that happened through December 30th. The services were still, we want to continue those services with community-based testing, and we were hopeful that another round of stimulus was occurring. We just didn't know exactly when and how much. So we had moved forward thinking that we may try to identify some state funds to support for a day or two until we could have that COVID funding new round of stimulus come about. So what happened, there was state funds placed on one of the modifications we were trying to push it through, but later with that COVID funding, it was happening at the same time, we retracted the plan for any general fund use to then insert federal. So federal CARES CRF, coronavirus relief funds, through December. From December 31st forward, it's now ELC federal COVID relief through the coronavirus response and relief funding, the one that was approved December the 28th, I believe it was. So no general funds have been used or plan to be used for these services.
Thank you.
Okay, so no general funds in that. That's clarifies a lot for everyone. Okay, I will entertain a motion to approve. Motion by Senator Meredith, seconded by Representative Mentor. Madam Clerk, please call the roll.
Senator Hornback, Senator Southworth, Senator Yates, Representative Bowling,
Yep.
Representative Hart,
Yes.
Representative Mentor, Senator Meredith, Chairman Cook.
Yes.
Did you call Representative Bowling? What'd I say? Okay.
It is late. Okay.
Yeah, we're late.
The next meeting is scheduled for Tuesday, March 9th, 2021 at 9 a.m. I will entertain a motion to adjourn. Motion by Senator Meredith, second. Second by Representative Bowling. All those in favor signify by saying aye. Aye. Motion carries. We don't need a roll call.